welcome everybody. Thank you for joining us for the fourth monthly session of our Health and Energy Program Design Network trainings. My name is Christine Gerbode. I'm a senior research analyst at ACEEE on the Health and Environment team. On the line today as well, you might hear Sarah Hayes, who is our team lead. This is the fourth of 5 big picture sessions that we have planned for this spring as part of this network. As a reminder for those of you joining us for the first time, this is a network geared towards supporting energy efficiency programs and administrators who have an interest in incorporating health into their work. So today we're going to be focusing on building relationships and partnerships that can help expand services and funding for programs. And I'm very excited to just say that we'll also have some special guests today. So today's session is being recorded and that will be available to participants afterwards. We will have some breakout rooms later today and those will not be recorded, however. So. For those of you who haven't connected with us before, we are the American Council for an Energy Efficient Economy, or ACEEE. We're a research nonprofit working to catalyze and advance energy efficiency across a range of sectors and channels. And so we're going to start out quickly with just a little bit of housekeeping, and then I'm very excited to note that we're going to be hearing from Emily Lewis O'Brien of VEIC and Robin King of Efficiency Vermont for the main content of today's session on partnerships in the energy and health space. So if you have questions as we go, feel free to type them into the chat box and we'll respond to them as we're able to do so. We're going to be dropping links and instructions into that chat box as well throughout the session. So you may want to have that window open. It's going to be, yeah. So we'll do a presentation from the VEIC folks, then we're going to do some breakout work and then a little bit of wrap up and polling at the end. And then, yeah, we'll have time for Q&A or any other concerns that come up. So. Okay, so just to recap, we do have all the resources from the past sessions in one place. I believe we are dropping those into the chat in a moment. That includes all the recordings of sessions 1, 2, and 3 from January, February, and March. February, March, and April, excuse me, as well as the slides and all the guidance documents that we put together for those sessions. We do also have a folder in there for the equity deep dive from earlier this month. So we did not have a recording from that one, but we do have Ariel's amazing slides and the links to the reports and resources that participants shared out. Let me just double check that we have our link shared real quick. Second. All right, here we go. Thank you for bearing with me. So that we did get some questions again about whether it's okay to share these materials, and the answer is yes. The more the merrier. Feel free to send these to anyone who's interested, and send anyone who's interested to us if they'd like to be added to the mailing list for these events. So we're going to do some quick polling. First and foremost, I want to ask. So as you know, our 5th session coming up in June is going to be a sort of a showcase of some of the work that people in this network have been doing. And we're looking for people who are interested in talking a little bit about what they've been doing to incorporate health into their program, whether that's something they've completed already or initiatives they have coming up. So if you think you might be interested in speaking for a few minutes at our June 24th session, even if it's just to talk through some questions you have or just anything you want to bounce off the group, go ahead and let us know here. And if you're not sure, let us know as well, and I'll be able to reach out to you after the session to talk about whether what you might present is a good fit. So give you just a few more seconds to answer this. And so we're hoping that that'll be a good way to kind of integrate a lot of the topics that we've covered over the course of the spring and see what some people have been up to. So. All right, I'm about to close the poll, so get your answer in. And okay, great. So next, quickly, I just want to ask, for those of you who were able to attend the session 3 on measuring and documenting health impacts in your program, we're hoping to capture what you did as a result of that. So if you took any actions after that session, feel free to mark them here. And if you did not attend session 4, or session 3, that's okay. Just let us know that too. So some of the things that we're looking for is whether you maybe incorporated something new that you learned into your work, whether you looked up or sought out more information on some of the methods or strategies that we discussed during that session, the different types of impacts you might measure or ways to do so, whether you followed up with somebody you met in a breakout session, because we've seen evidence that that's happening and that people are meeting each other through these sessions, whether you are looking at changing how your program is collecting data as a result of that session, or what kind of data you're collecting, or if you have something else that you did as a result, you can send me a private chat message if you want to elaborate on what that is. And I'm going to close the poll in just a few seconds. So got 5 seconds. All right. Thank you. Great. So one more reminder, the next session that we have coming up is our second quote deep dive. And so these are sessions that have been generated by interest from you all on certain topics. So the first one on equity was earlier this month. The one coming up in June, that'll be not next Thursday, but the Thursday after, is on cost effectiveness testing and quantifying and monetizing health impacts. So we will be hoping you can join us then. And let me drop the link for that in real quick as well. 1 second. There we go. Where is it? There we are. All right. So yeah, you can register here, and you may have received a calendar invite for this. If you have not, feel free to reach out to me afterwards, and I'll make sure you're on our list properly. Okay. So with that, one more piece of today's puzzle is we are once again going to be using these digital workbooks that we've been using for the last few sessions, which help us to capture, hoping that they kind of help structure thinking about some of the topics that we are discussing. And they can also serve as a place for you to save, take notes that you can save and access later. They also serve as a way for us to get feedback on how the session has gone for you and what parts were useful so that we can do more of that in the future. So these are really helpful for us if you engage with them. So I've dropped the link for the session 4 workbook into the chat. So if you go ahead and open that up now, it'll be ready for later. We're going to use it during the breakout session. So if you have any problems accessing it, sometimes people have firewall issues, let me know, and we can help you figure that out later in the session. So, all right, and with that, I believe we're about done. All right, so, all right, so once again, oh, there we go, okay, right. So like I said earlier, the focus of today's session is going to be building relationships to expand services and funding for your program. And I'm excited to say that we're joined by Emily Lewis O'Brien and Robin King of VEIC, who are going to be talking through some of the great work they've done on this topic on the ground in Vermont. So if you were on the calendar invite for the session, you should have received an email with a PDF of some useful reading to accompany today's session. And that's an excerpt from VEIC's Energy Plus Health Playbook. So if you didn't get that for any reason, it's also been uploaded to the resources folder for today's session. And we'll send it out again today in the follow-up. And in a minute, once they get started, I'm also going to drop a link to the Energy Plus Health Playbook in its entirety. Let me quickly introduce the two of them. So we'll first hear from Emily. And Emily is a senior consultant at VEIC who specializes in beneficial electrification of buildings and transportation with a focus on the low to moderate income market. She has a broad background in state and federal energy policy development, data-driven clean energy advocacy, and scientific research on the chemistry of energy technologies. Before she joined VEIC, Emily led the electrification initiative and analysis team at Acadia Center, which is a clean energy research and advocacy organization. Emily also served as a science and technology policy fellow at the US DOE and on the on the US House of Representatives Natural Resources Committee. And she conducted her PhD research at Tufts University and her MS and BS research at Northeastern. And after her, we will hear from Robin King. Robin joined Efficiency Vermont in September of 2019 as a program manager for existing homes programming. Currently, her work focuses on enabling Vermonters to access resources to make their homes more comfortable, energy efficient, and healthy. And before her current role, Robin has held positions in in community outreach, engagement, and planning, and has helped local community members make land use decisions. She's consulted on community energy topics and led efforts on downtown revitalizations and sustainable development. Robin holds a Bachelor's of Arts in International Relations and Environmental Studies from the State University of New York at Tennessee. I don't know my New York geography, I'm so sorry, and a master's in urban and regional planning, a focus on environmental planning from the State University of New York at Albany. With that, I will turn the floor over to them. So.
All right, thanks, Christine. You can go ahead and flip it right to the next slide. Awesome. So, yep, as Christine said, I'm Emily Lewis O'Brien. I'm a senior consultant at VEIC. And for those of you who don't know, VEIC is a mission-driven nonprofit organization delivering decarbonization solutions for the energy sector. And we work across 4 core areas, including energy efficiency, building decarbonization, transportation electrification, and a clean and flexible grid. You can flip to the next slide. There we go. Cool. So I'm here to talk about VEIC's Energy Plus Health Playbook that we put out in 2019. And we developed this with support from E for the Future and in partnership with Tone Environmental Strategies. And the playbook is really intended to be used by PAs as a guide to developing these Energy Plus Health type programs. So it's got program design guidelines, resources, case studies, other materials in there that can be really useful for developing this type of program. So if you go to the next slide, I wanted to talk briefly through the outline. So today we're focusing on section 5 of that resource, which is really focused on partnerships in the healthcare industry. But as Christine mentioned, the whole guidebook, I believe, is now available in the chat, and it covers anything from making the case for these types of programs, choosing the right program model for your particular energy efficiency program, successful design strategies, and then case studies and other resources at the end. So today, again, we'll be talking about section 5, but just so you know what's in there, it's a really valuable resource, and I would encourage you to check it out. So on the next slide, yes, I wanted to start today by talking about 5 key strategies to building cross-sector collaboration. So the first of those is building buy-in, which is really about understanding the mutual goals between you and your partner. In the energy space, we're always talking about kilowatt hours saved. Maybe you're looking at greenhouse gas metrics, but the health sector really only cares about health outcomes. So you got to find that space where, the Venn diagram of the overlap there. So you're looking at mutually beneficial goals. The next key step is identifying partners. The health sector is pretty vast, and not all of those people there are going to be the best partners for you, but you can identify partners who are really willing to help in this space. And that's a key strategy of building these collaborations. Another piece is identifying key roles. And so one of those key roles is actually identifying who's going to be coordinating. There's a lot of moving pieces in an Energy Plus Health program, and you want to make sure you're not either stepping on each other's toes or tripping over each other, getting in the way, and you want to have a streamlined experience for the people you're serving. So outlining that coordinating role as well as other roles in the program is really important. It's also important to identify key cross-sector challenges up front. Again, in energy, we talk a lot about kilowatt hours. People in the health sector may not know what a kilowatt hour is. And at the same time, the health sector is really cares about patient privacy. And not that we don't care about that in energy, but the rules are different. And so just identifying that there are differences in our sectors up front. We don't have to be experts in each other's sectors, but we do just have to know what the challenges are and work within the confines of those barriers. And then finally, everybody wants to build a collaboration to, leverage for success. So when you can really identify these positive outcomes that you're both, aligned with, that's where you can really braid resources and build collaboration around these really positive health outcomes. So identifying those goals and working towards them is a great way to build cross-sector collaboration. So next slide, please. So I wanted to start by talking about the different tiers of Energy Plus Health programs. And I wanted to do that because each sort of tier has different stakeholders that you really need to be focused on. And so the increasing tier number kind of indicates a higher level of effort in terms of designing an Energy Plus Health program, but it also has the greatest opportunity for those really positive health outcomes. So starting at the most basic level, tier 1, this is just adhering to basic health and safety standards within your energy efficiency program. So, when you're doing retrofits, when you're doing energy audits, you're making sure you're adhering to those combustion safety, minimum health safety standards. you might be working with a community-based organization to distribute things like energy efficiency kits, but there's no formal partnership there. They're really doing this on behalf of you because they see the value in distributing those energy efficiency measures, but it's not a formal partnership. Tier 2 is where you start getting into cross-sector referrals. This is probably an area where you need to have a formalized agreement between the energy efficiency partner and your community or health partner. And the hallmark of this tier is really where you're having in-home visits conducted by any entity, and you're doing cross referrals. So if somebody does a home visit for a health reason, they can identify, oh, you could potentially benefit from an energy efficiency program, and they refer that patient to you, and vice versa. You might be using something like a tracking platform to keep track of who's been in a home visit and who's been referred where. But importantly, in tier 2, you have different sectors delivering their own services. So it's still somewhat siloed. You're just having those referrals. And then in tier 3, you're really getting into the integrated energy plus health programming. And so you have a formal collaboration between an energy efficiency provider and health entities, community entities. You might be targeting households that have specific health conditions. So sometimes a health provider will say, this person has COPD, I'm going to refer them to the energy efficiency or Healthy Homes really at that point program. The health entity is probably tracking data and dealing with a lot of the privacy issues on the healthcare side. And you're potentially getting funding from some of these healthcare partners to cover the energy efficiency expenses. So you can go to the next slide, Christine. So within tier 1, the stakeholders are probably going to be pretty familiar to a lot of people on this call. You have your program administrator. Again, they're working just to do no harm. They're ensuring quality control of the people working within the programs, but they're really just delivering an energy efficiency program. That's what they're there for. The community-based organizations, again, they might be delivering some energy efficiency services, but they're really focused on their goals, but they still remain really well positioned to potentially be looking at some of these home hazards. And then the home energy contractors, again, they're energy efficiency contractors, again, doing those meet no harm standards to deliver energy efficiency retrofits and measures. Next slide, please. So in tier 2, again, this is where you're starting to get those cross-sector referrals. So the PA, the CBO, and the home energy contractors remain largely the same. They're in the energy efficiency space, but where you have the referrals happening is in these home visiting programs. And so that's where you have a partnership formed. You have people assessing households for within their own silos, but making those referrals. So again, you have an energy efficiency auditor coming in and saying, oh, you might benefit from this other homes program. And so this is where Vermont Healthy Homes really started, was as a tier 2 program, and it sort of spurred off a tier 3 pilot program, and that's what Robin's going to talk about in a minute. So then, yep, tier 3, and you'll see the stakeholders have somewhat changed in this type of program. So you have the PA now has the role not only of delivering that energy efficiency program, but they're also providing training and quality control for contractors and assessors to have these BPI certifications or other DOE WAP assessment and expanded action standards in place. You see now healthcare providers are part of the core stakeholders, and again, they're providing maybe screening for eligibility or tracking those health metrics and helping with evaluation, maybe contributing some funding. On the contractors and assessors side, they are receiving those expanded trainings from the PA, and they are certified in these Healthy Homes evaluations. So they can go in now to a home and not only just say, oh, you should talk to this other program, but they can say, oh, you have a lead problem or an asbestos problem. And potentially, the contractors could be trained to address those problems. So it's just much more integrated. You don't have everybody in their own space so much. So you can go to the next slide. So there are a lot of points of entry in the healthcare industry, as I teed up before, and I'm going to show them on the next slide. But I did want to identify that working at multiple points within the healthcare system is really a key strategy just to form a robust partnership and ensure that long-term sustainability of the collaboration. Sometimes if you're just focused on one entity or even one person within an entity, that person changes jobs and you've kind of got to start over at square one. So making sure you have multiple points of entry is really kind of key. So if you go to the next slide, This is a range of potential energy plus health partners. And there are a bunch of them here, healthcare providers and hospitals. Those are sort of what you think of when you think about healthcare, but there are a lot of other entities, school nurse associations, accountable care organizations, for example, are groups of providers that share responsibility for quality care and healthcare costs over a large population. So, they're almost at a higher level and could potentially be a good entry road to reaching some of the people working in hospitals or in some of these managed care facilities. Another group on here that's hard to overemphasize is community-based organizations. These are organizations committed already to their communities and helping them leverage resources. Sometimes they're focused on health outcomes, sometimes they're focused on other things, but really they're focused on the well-being of their community. So they're really great partners for a program that's focused on overall health and well-being. I did want to emphasize that the basic process for forming any new partnership is really just based on getting to know people and knowing what their pain points are in some reasons. And you don't learn that just by like looking on the website. You have to kind of go to these meetings or go to, you have to talk to people, I guess is what I'm trying to say. You can't just cold call people necessarily. So you have to kind of do your research, start showing up, and that's where you can form the partnerships. You can go to the next slide. So I did want to focus on hospitals just because they're an obvious choice for a partner here. So just like you want to engage at multiple points within the healthcare system, a hospital is another place where you can engage at multiple points. Recognizing that people at different levels within the hospital structure are going to know different things. So you have to kind of be able to tailor your message to who you're speaking to there. And importantly, there are different kinds of hospitals. There are for-profit entities, nonprofit hospitals, both academic and research hospitals as well. And they all have different priorities and goals and metrics that they're working towards. So knowing not only who you're talking to there, but what type of hospital it is really important. But just some strategies, and these are pulled from the playbook. Executive directors are going to be really concerned potentially with costs, right? So if you can talk to them about how an Energy Plus Health program would reduce healthcare costs, that's a good message to try to reach them with. In terms of people with external facing roles like health officers, community health workers, equity officers, those are people focused again on the community well-being. So if you can talk about how Energy Plus Health programs work towards that goal, that's a good way to engage those types of partners. You might not necessarily think about engaging an HR department at a hospital, but one way to get energy efficiency programs out there is to get employees of the hospital to know about them, and then they can talk about the benefits of energy efficiency programs to their patients. So if you engage an HR department to do an energy efficiency training or otherwise run an educational program for employees, that can help them relay that information to their patients. So don't discount people that don't necessarily have a health-focused role even. You can go to the next slide. So just a couple other ways of engaging hospitals, specifically nonprofit hospitals have to do these community health needs assessments every 3 years. And this is nonprofit hospitals have to prove their benefit to the community to maintain their tax exempt status. So with these needs assessments, if you can make an inroad and demonstrate the importance of Energy Plus Health in improving public health outcomes, you could potentially build that into their planning around the needs assessment. So public comment periods are a really good opportunity to do that. And then one final engagement strategy with hospitals is that hospitals have indoor air quality standards that they must maintain as medical facilities. So if you can demonstrate or talk about people not having those indoor air quality standards in their homes or not meeting them in their homes, you can kind of start to connect the dots with something that's easily relatable to them because they know they have their own indoor air quality standards. So, yep. Just on my last slide here, I teed up a couple other partners that are worth looking at, but the list continues on. So community health teams and community health workers. Again, these are people with outward facing roles. They're already engaged in their communities and they're working to support public health. So you can see that their goals would be pretty well aligned with an Energy Plus Health program. They might be conducting in-home visits already, so they would be good targets for making referrals potentially to a program. And they're also, because they're doing these in-home visits, because they're already in their communities, they're pretty well-trusted partners and messengers. So that's another barrier potentially to programs is if you knock on somebody's door, if they don't know you, they might not answer, but making sure you're working with these trusted messengers can really help break down that particular barrier. Managed care organizations are another target. They administer Medicaid services on behalf of states. And they also likely are conducting in-home intervention programs, they may be. And because they have their own funding and can sometimes count energy efficiency expenses as medical expenses if you can demonstrate they have improved health outcomes. Finally, public health departments are another place to target. Again, they're just working in their communities. They do a lot of health tracking. They're running programs, providing services already. So again, having that shared goal with an energy plus health type program. So a good target there. So that's all from me. I'm going to hand it over to Robin. She's been doing this hands-on with Efficiency Vermont. So I was talking at a high level. She's going to give you some specific case studies.
Thank you, Emily, and thanks for everyone who's on this call for joining us today to talk about, this specific topic. So I am working both for VEIC, but specifically for Efficiency Vermont. And for those who are unfamiliar with Efficiency Vermont, we are a statewide energy efficiency utility. There are two other energy efficiency utilities in the state, both VGS and BED, and we work with them very closely. Part of our mission is to reduce the cost of energy for all Vermonters. And we primarily help families, businesses and institutions understand and make better use of energy and reduce greenhouse gas emissions. And we do this through a variety of service channels and through kind of some of our staff work. So Christine, if you could advance the next slide. Thanks. So we provide direct support through incentives. We also provide training and technical advice. We at our core are a organization and energy efficiency utility that's very close with a lot of different stakeholders in the state. So we do have a lot of pre-existing partnerships and channels that we typically work through. And as you all may know, Vermont is a pretty small state. So there's a lot of folks that we just know by proxy because we're all kind of in this community together. You could continue advancing. So this slide shows some of our impacts, which we're really proud of. We have saved over $2.8 billion for our customers from 2000 to 2020. We also work with a lot of folks to try and generate workforce development opportunities. We do have what we call the Efficiency Excellence Network, which is our partners who are out in the field doing the important work of installing heat pumps and completing weatherization jobs. So we are really grateful to have the partnership of so many folks in the state working in this space. And some of these other metrics are also really important, but I think everyone could refer to the slide in the future if you want to read through it. But just trying to emphasize that we, through our partners, are able to achieve these outcomes. And so we find partnership to be at the core of everything that we do. Next slide. So this slide shows some statistics about housing in Vermont. And this comes specifically from the National Center for Healthy Housing. So there are likely these exact sheets for different states across the entire country. So if anyone on this call is interested in getting your own specific state snapshot, I'd recommend that you visit the website for the National Center for Healthy Housing. But when looking at these statistics, there's a lot that jumps out at me specifically, but I think as a data-driven organization, we always like to take a look at the data to see how we can right-size our effort to meet the need. So Vermont housing stock is slightly older than the average and then the national average. We also do have a significant cost burden across the state, and we're always looking at opportunities to reduce the energy burden for those who are most affected. We also do have a number of Vermonters who have unfortunate outcomes of unintentional falls, and we are a relatively old state, not speaking of like when we were actually formed, but in terms of our overall population. So these are some of the things that have informed us and helped guide our direction in this space. And it's certainly something that we are consistently focused on, is how we can increase the health outcomes of our population. Next slide. So the Healthy Homes vision that we have is through efficiency, Vermont homes are safe, affordable, comfortable, durable, and resilient, resulting in an improvement in population health and a reduction in greenhouse gases. Part of our scope as an organization is to focus on energy efficiency specifically, but I think everyone in this call knows that efficiency plus health is a very important space for us to all work in. So, I'm going to, in the next couple slides, dive a little deeper into our partnerships and how we leverage those to deliver the services that we have specifically in the healthy home space. Next slide. So we have 4 key goals that are kind of guiding our development of the services. The first is to provide cost-effective services that improve health outcomes while reducing energy burden. We actually do on our website have an energy burden report if anyone is interested in getting Vermont-specific statistics on how things differ across the state. It is a very interesting snapshot, so just something to point out. Goal 2 is to increase impact through strong, mutually beneficial, healthy home partnerships, which is what we're focused on today. Goal 3 is to be a credible and valued partner in the health/energy nexus. And goal 4 is to create a clear strategy for healthy, affordable homes. Next slide. So through 2018 to 2020, we had pilots. These were 3 specific pilots where we worked with local hospitals and the weatherization assistance programs. It was launched in 2018 and we wrapped up in 2020. And I'll also note here that we do have some white papers that detail the outcomes of these pilots kind of on an annual basis. So if anyone's interested in digging deeper, those are also available on our website. So each program, as I mentioned, partners with the local hospital and with the low-income weatherization agency. 2 programs were focused on asthma and COPD patients, and the goal was for 10 participants each. The one for falls prevention had a goal of 20 participants. So this worked through the end of 2020. And I wanted to point out that these pilots, as they're working with low-income households, all upgrades and supplies are offered for free. You can advance to the next slide. The partners that we worked with on this program specifically. So for us, we took on the program development coordination. We allocated funding for special measures for this pilot. We also did indoor air quality pre and post testing. The hospital community health team was responsible for identifying participants, health coaching, and connecting with additional services. They also collected pre and post surveys. And for the weatherization programs, they installed typical weatherization measures, and there was allocated funding for certain special measures in the pilot, and they also reported on energy savings. This is something that we actually really collaborated on closely with the partners, and there really was a 2-way communication stream. So that is more indicative of that, tier 2 to tier 3 program, where instead of an FYI, it was really a clear back and forth. So during this pilot, there were check-in calls to discuss each participant and each project as a group. And there was frequent communication outside of those calls as well. So this was really a big coordinated effort. We also, thanks Christine for advancing the slide. We also kind of spurred out of the pilot, we're able to offer what we call virtual healthy home energy visits. So these are visits that are delivered by Efficiency Vermont staff who have a Healthy Home Evaluator certification. Originally, we had designed this offer so that this could be done in person for a lot of different reasons. There's a lot that you could see and observe in a home when you're actually there. But during the pandemic, we wanted to be very cautious as an organization about site visits and guidance around site visits. So we opted to convert these visits into a virtual platform. We use our Teams platform to conduct these visits for homeowners. We could either do it over the phone or on a screen, and we partner with our healthcare provider partners, primarily UVM Medical Center, to get patient referrals, and the patients actually give consent so that we can share the information on the back end that we learned during the visit. And we offer, and I'll go into this a little bit further on the next slide, IAQ monitoring to the participants so that they can get a snapshot of what their home's indoor air quality usage or indoor air quality looks like prior to the visit taking place. So this is, again, part of that kind of back and forth that we have with the healthcare provider partner. Our kind of interest is to be able to speak to the homeowner about efficiency opportunities and things that they may not be thinking about as triggers, or things that they may not be paying that close attention to. And then on the back end, the healthcare provider partner is getting information that they can speak to their patient about that may or may not be as apparent to the patient, or get more intel on kind of what the patient is seeing, or different trends across the board. So it's a great collaboration, and we're very lucky to have these partners working in this space. Next slide. So this is, I mentioned this very quickly. We have an indoor air quality monitor loan program that feeds directly into that virtual healthy home energy visit offering. And so this is a program where we offer customers the opportunity to have an indoor air quality monitor shipped to their home at no cost. We give instructions on how to run the monitor and how to view the results. And this feeds directly into the output that we're providing to the healthcare partners, so that they understand some of the triggers or other things that may exist in the home, and gives a better sense of what their patients might be seeing. So this is something that we did typically offer to, we had kind of a couple of tranches of customers that we served. First internal staff, just to see how it worked, and then some of our partners. And we had opened it up to customers who call in who have questions about indoor air quality, as well as our referrals to our healthcare partners. And we are kind of primarily targeting now the referrals from our healthcare partners, just as it seems like that is where the most interest is, but it's certainly something that we're excited to continue to offer in the future. Next slide. We also have defined what we call a healthy home energy assessment, which is something that we rely on our contractor partners to deliver to their customers. So we have taken guidance that is industry standards across the country, and we've created essentially a platform or a network of contractors that can look at a basic data collection sheet and go through and look at a home comprehensively as it relates to the 8 principles of healthy homes. So this is kind of a private service that our contractor partners offer in the marketplace, and then can report back to us what the results are if it seems appropriate to the customer and the contractor. So it's a well-defined service, and it's something that the contractor partners who are interested in offering can do as a value add to their business model. So it's a little above and beyond the tier 1 do no harm. It's a little bit more in the tier 2 sector, but it's something that we're definitely interested in expanding on in the future, especially as some of our home performance program reporting goes more into a data-driven area. You can continue. So our Healthy Home Contractors, as I mentioned, these are members of our Efficiency Excellence Network that also hold the Healthy Home Evaluator certification and agree to a specific set of standards in a participation agreement, and also take place in a specific training that we have crafted in-house. So once a contractor moves through those requirements, they're able to offer those healthy home energy assessments, and then have a back and forth with us on what they're seeing out in the market. You can move on. So the key takeaways kind of from our early days in the Vermont health plus energy space in terms of our partnerships is that it's really important to be holistic in outreach during program design, to think about both organizational and supply chain partners. The second takeaway is to keep in mind, as Emily kind of talked about, the different value propositions of different partners. There are spaces where we sometimes speak in different languages, and it's great to kind of find a commonality, that Venn diagram of where we can have both values kept in mind, but also can be mutual beneficial. The third key takeaway is that consistent communication during program implementation is important. I mentioned our healthcare provider partners, and we do have constant check-in calls. We check in with our weatherization assistance program partners. So I think consistent and clear communication is key. So that's kind of what we have learned so far, but certainly we will continue to learn as we refine and expand our program services in the future. So it's been a great experience, and again, we owe it all to our partners. We couldn't do this without them. And that is all I have. So thank you so much.
Fantastic. Thank you both. And there's contact information for both of our presenters today. We've got just a few minutes for questions if anyone has anything directly about, maybe more like clarifying questions, but we are about to move into breakout rooms after this too. So if anyone has anything they want to drop in the chat quickly, you can do that. Otherwise, I will say, let's gear up to jump into breakouts. So, okay, so for today's session, I just dropped the workbook link into the chat again. If you go to page 2 of that, you will see the breakout questions that we're about to show on the next page. As usual, I recommend everybody briefly introduce yourselves and then nominate a facilitator to kind of help make sure everybody's getting a chance to speak. We'll have about 15 minutes for these breakouts. So, so the questions that we're going to talk through is, we'd just like you all to talk through whether anybody in the group that you're in has experience forming these kinds of partnerships that we've discussed today, that they would be willing to share. And if not, or if so, I want to have people think through who are some of the potential partners in your region that you might reach out to start developing an Energy Plus Health program, or to turn your program into an Energy Plus Health program, I suppose. And think through how you might consider engaging with these partners and when. So with that, let me set up the breakouts quickly. And right. And they should be opening now. So hey everyone, welcome back. All right, looks like everybody is back. So hope everyone had a good discussion. If you still have your workbook open, go ahead and fill out any feedback you have on today's session in the questions at the bottom, as well as capturing any interesting ideas that came up during your discussion. I do want to quickly launch one more poll for you guys, just to capture any kinds of next steps you think you might take as a result of today's session. So if you think you might be better equipped now to search for new health partners in your service area, if you're going to follow up with someone you met in a breakout room, if you think you'll be ready to reach out to a new potential partner using some of the strategies and concepts that we talked about today, if there's things you want to follow up on that you learned about today, if you think you're ready to incorporate a strategy that you learned during today's session in your work, or if there's something else that came up from today that you want to tell us about, feel free to shoot me a private message. I'll leave that open for just a few more seconds. But I do want to encourage you all also to make sure you do finish out that workbook and send it to us so that we can learn about what was useful about today's session and what kind of things we could improve on in the future. So it really does help us to get that feedback. So I'm going to close the poll now. Thank you. So go. Right, so do you want to plug one more time the Google group forum for this network? Just drop the link for that into the chat. If you go ahead and introduce yourself on that forum, it will help other people find you and help you find other people in your region that are working on these things. So this is another opportunity for networking and connecting to others working in this space and trying to figure out some of these challenges together. So we've got over 270 people in that group. So if you make yourself visible in it, it may be very beneficial to everyone in the end. So, and if you need access to that group, you can always email me for help to get it. So we do have a couple of sessions coming up still in the books. Like we said earlier, not this next Thursday, but the Thursday after June 10th, we'll be doing our second deep dive into cost effectiveness testing and quantifying and monetizing impacts. And then at the end of the month, we're going to do that programs in the wild peer sharing that we talked about earlier. So again, if you haven't already said you were interested, and if you change your mind and would like to maybe say a few words about what you're working on and what you've especially any changes that have come about for your program as a result of participating in this network this spring, we would love to hear about it and feature you. So go ahead and email me if you'd like to do that. And other than that, we have a couple minutes for questions if anyone wants to unmute themselves and make a comment or a question. Otherwise, I'll stay on the line for just a few minutes after the hour in case there's any issues or tech things that come up. otherwise, I hope everyone has a great Memorial Day weekend, and we will be ready to see you in June. So.